So an important topic to discuss is stress and burnout. When you become too stressed, it puts a lot of strain on the body, from the adrenals to the nerves to the brain. And what you really need to do is manage that. And sometimes it's not your fault, but starting out with good sleep is really important. You could do some box breathing, which is where you hold your breath for 2 seconds, you breathe out for 2 seconds, you inhale for 2 seconds, you hold your breath for 2 seconds. That can help to calm down the nervous system. You can also take different adaptogens, ashwagandha, rhodiola. There's different adaptogens they're really herbal remedies to help to calm things down. I'm not talking about taking Zoloft or Prozac or a drug. And stress and chronic burnout can also be alleviated by doing things like nervous system regulation, getting out, exercising. But if that's not enough, we can actually test. We can hook up a heart rate variability monitor, HRV. We can see if your foot's on the sympathetic gas pedal, and that if you're in this state of fight or flight. And if you are, we need to really adjust that. Our IV therapy can be really great. It can help to de-stress you. It can help to get nutrients into your body. But being in chronic stress in a state of that can lead to burnout and ultimately a demise of your health and well-being.